Hey guys, this is Chris Dewey with Senior Life Mutual. And for all the folks that are on my email list, this is our third email in the last couple days with a quick video. Today, the last video was on the different parts of Medicare. Today's video of the 7-part series is by far the most impactful, most important thing that you're going to take from the whole series. And I need you to pay attention because most of you are folks that are turning 65 this year, or you're going to enroll in Part B, one of the two. So we're going to talk about turning 65 and how that triggers on your birthday. That triggers your open enrollment period. And your open enrollment period, it's not like the annual enrollment from October 15th to December 7th when you can change Advantage plans and drug plans. Open enrollment's a one-time thing. And what that is the month of your birthday, it triggers it. When you go on, when you have A and B, the effective date, the date of your 65th birthday, your birthday, you got 6 months. That's it, 6 months to enroll in a Medicare supplement. And what do I mean by Medicare supplement? A Medicare supplement that pays all or most of your bills. You can enroll in a Medicare supplement with no health questions asked. After that 6 months, they ask health questions. They do a phone interview and ask you questions about medications you take. And there's a chance that you can't get a Medicare supplement after that 6 months. So it's it's the best time to get a supplement because you can get the rate of a healthy person. Even if you had cancer, you're going to get a healthy low rate for the Medicare supplement plan of your choosing. So you got Part A, Part B, and this Medicare choosing a medigap policy has information on original Medicare, talks a little bit about Medicare Advantage, what the difference is. Remember, Medicare supplement is not Medicare Advantage. All right, it's they pay what Medicare is your primary insurance. The supplement jumps on top of that and pays the rest. Medicare Advantage is an alternative to original Medicare. All right, so we're going to go through the choosing a medigap policy. This year's guide has some key components that we need to look at. I want to draw your attention to one part of this document that really outlines what's going to be different on January 1st of 2020. All right, because MACRA, which is a bill that Congress passed, I think in 2015, yeah, they passed this bill, and that bill takes effect January 1st of 2020. So, we're going to read about the Plan F, the Medicare Supplement Plan F and C are no longer going to be available, meaning the Plan F and Plan C, if you have the Plan F or C, you can keep it. Or even if, as long as you turn 65 before January 1st, you can enroll in the Plan F or C 3 or 4 years from now. Meaning the Plan F and Plan C, if you have the Plan F or C, you can keep it. Or even if, as long as you turn 65 before January 1st, you can enroll in the Plan F or C 3 or 4 years from now. As long as you were born before, or you not born, but before you went on Medicare before January 1st. So this MACRA law, because the Plan F and C are being discontinued, it's going to have an effect on other different Medicare supplement plans, and we're going to talk about that a little. Also on Monday, I got home, got some sad news. A gentleman, he must have been one of the very first. I used to work for Just Humana. I was a career agent, meaning they paid me a salary. I only could sell Humana products. And this guy was one of my first people that I enrolled in an Advantage plan. And he lives in a pretty wealthy area, the Landings, and he golfs and he's been very active. But he when he was 65, which is 10 years ago, he went with the zero premium HMO. He loved it. He thought it was great that he didn't have to pay a premium. Didn't care. He went to the doctors once a year. He used the Silver Sneakers gym membership. And, I call him every year just to see how he's doing. He loves his Humana well. His wife called. I got back on Monday afternoon. I took my daughter Emma to visit colleges, and we went to the University of Georgia, UGA. I loved it. What a beautiful town and campus. But I think she's leaning more towards Tennessee, the Volunteers. Anyway, so I get the message, and his wife, Bill's wife, he's got cancer. He's got, I think, stage 2 liver cancer. And anyway, his doctor recommended he change to a supplement. Well, problem is he's been diagnosed with cancer. That's one of the questions on the underwriting. They ask kidney disease, HIV, but, cancer. So he's stuck. He's stuck in a Medicare Advantage plan, and a lot of the cancer places that he wants to go to are not in network. So he'd have to pay 100% of it. So it's sad, and I guess it puzzles me as to why people turning 65, they just don't spend enough time to get past the low monthly premium that an Advantage plan gives you when they're selecting the most important thing possible to their health. So, the zero premium, isn't working for Bill right now. He is in a strict HMO network. He's got money to go to get the best care in the world. With a Medicare supplement, there's no network. With a Medicare supplement, whoever takes Medicare takes the supplement. So I think there's over 800,000 different. Most people take Medicare. Pretty much everybody takes Medicare. Okay, there's a few that don't, but it's unusual. So, when it comes to care, I don't get it. You have the ability with a Medicare supplement to go where you want to go, see who you want to see, and with an Advantage plan, you have these restrictive networks, and the impact of a co-payment plan like a Medicare Advantage plan, it's a restrictive plan, and the impact of that on your choices, the impact of that on your health choices. I just don't know. We really gotta think about this open enrollment. Last thing I'll say is Medicare Advantage plans are amazing for my disability clients. My girlfriend's a Social Security disability attorney. You know what? Thank God they're there for those folks. They've got some Medicare Medicaid Advantage plans. They've got chronic special needs plans, and the Advantage plans. If they didn't have Advantage plans, my disability clients would they'd have to pay 20% of everything. They just couldn't do it. So Advantage plans have their place. But I guess what I'm trying to say is, well, let's do this. Let's look right here. Let's look. Where is it? Okay. So it says on page, where is it? Page 16 of the book. Why is it important to buy a medigap policy when I'm first eligible? All right. Let's take a look at that. So when I say medigap policy, I'm talking about a Medicare supplement where traditional Medicare pays first and the supplement pays everything else. I'm not talking about an Advantage plan where there's co-pays, and I'm not talking about where you can only go to certain doctors. Basically, you trade in your original Medicare and you turn over those rights to the insurance company that manages your care. So Medicare, they pay the insurance company per person a fixed cost every month. Humana, let's say you have Humana, Medicare pays Humana a fixed cost to manage your care. And the reality is they're going to do it as cheaply as possible. They have restrictive networks because it's cheaper, it saves them money. And you just have to be aware that, listen, I write lots of Medicare Advantage plans. It's great for folks on disability. It's great for folks that are, have low income subsidy or get extra help. So, anyway, these advantage plans are not what I'm talking about as far as the supplements. So, why is it important to buy a medigap policy? A Medicare supplement is the same thing as the medigap. When you're first eligible, you have the right to buy any medigap policy offered in your state. In addition, you generally will get better prices and more choices among policies. It's very important to understand your medigap open enrollment period. That is triggered when you turn 65 on your birthday, or let's say you're older and you leave your group coverage with work and you enroll in Part B. You got that also triggers open enrollment for somebody in that situation. All right, so it's important to understand enrollment period. Medigap insurance companies are generally allowed to use medical underwriting to decide whether to accept your application and how much to charge for your medigap policy. However, if you apply during your medigap open enrollment period, again, 6 months from your birthday, 6 months you have. If you apply during your open enrollment period, you can buy a medigap, Medicare supplement that the company sells, even if you have cancer, HIV, for the same price as people in good health. If you apply for medigap coverage after that 6 month period, well, you're going to have underwriting. You're going to have requirements with underwriting, medical underwriting, questions. And they say, if you don't meet the medical underwriting requirements, unless you're eligible for guaranteed issue rights, guaranteed issue has nothing to do with open enrollment. Guaranteed issue would be if my neighbor Tom, he was the luckiest thing in the world. He had a Medicare Advantage plan, and the company that he had the Medicare Advantage plan went out of business. They just went out of business, or they left. So he got a one-time luxury, thank God. He had major heart issues, all kinds of health problems. I was able to get him guaranteed issue because he lost his plan, but you can't go to any old Medicare supplement you want. He was forced into the Plan F, and that is the most expensive Medicare supplement, and he's stuck there because he's in poor health, so he's in the Plan F forever. But thank God he's got it. He probably had $1 million worth of medical that Medicare didn't pay that the supplement did. All right, so the other example of a guaranteed issue would be if you lost your group or union coverage, you suddenly lost it, and you had your A and B, or you're a retiree, and your primary insurance is Medicare, and the secondary would be your union or retiree coverage. If they drop coverage, that would also be a guaranteed issue. No health questions asked, but you have to go. They stick in the Plan F, and that's what the insurance companies do. All right, so anyway, enough about that. So what they're saying is that if you apply for Medigap coverage after the enrollment period, there's no guarantee insurance company is going to get you a supplement, all right? So it is important for you to understand that your Medigap rights may depend when you choose to enroll in Medicare Part B. If you're 65 or older, your Medigap open enrollment begins when you enroll in Part B. Most of you are going to be enrolling in Part A and B the same month of your birthday, but again, there's other situations too. So when you're turning 65 and you're new to Medicare, you have three choices. So choice one, you get your red, white, and blue card. You're one of those guys that says, hey, I'm healthy, Medicare's enough. Like my buddy Anthony, he just, he had great health. The guy lifts weights, he dances, he's incredible, in good shape. So anyway, I met Anthony, and it was a referral, went to his house, 67 years old, and I went over the Plan F and the Plan G. We decided on the Plan G. because the rates are far steeper than the Plan G, and it's basically the same coverage, same benefits, just a lower premium. We got Anthony the Plan G, and 2 months later, he had I went heart attack, but he had open heart surgery. We had stents and all kinds of stuff, and he's had some other issues too. But let me tell you, tough guy. He'll be fine. He's already back at the gym. But the point is, had he just gone with just Medicare, and I hadn't appeared in his life, he would have paid 20% of whatever the surgeon charged, or the anesthesiologist. He would have paid a $1,300 Part A deductible right off the bat. He would have just physical therapy after that, 20% of everything. So, and there's no limit. There's no out-of-pocket limit. It's just 20% of whatever, and it's just there's no cap on it. So, MRIs, CT scans, specialists, you just pay 20. So, I guess what I'm trying to say is, just Medicare probably isn't your best move. Now, choice number 2, the Medicare Advantage plan. So let's talk about that for a second. And like I said, I help hundreds of people with Medicare Advantage over the years. I've got lots of folks that are Medicare, Medicaid. The folks I really love to help are my girlfriend's Social Security disability attorneys, because after 24 months of collecting disability benefits, they are eligible to enroll, and they get a Medicare card. And what we try to do is we try to find a plan that offers them, the doctors are in the network, and the drugs are in the formulary. So with the Medicare Advantage plan, the problem is, it's like I said, it's the only game in town for disabled people. But you turn 65 and you're in open enrollment. You got to remember one thing: when you take that Medicare card and you put it in your sock drawer and you enroll in a Medicare Advantage plan, because your Medicare's, throw that away. You don't use that. You're not on Medicare anymore. You are under the care of Humana or United Healthcare. They are a private insurance company. They get, like I said, a certain amount of money per month to manage your care. And they, I got to tell you, a lot of times I've seen situations where a procedure or operation or something has been denied. I've had to even get Meg involved. She's an attorney, and file appeals. The other thing about Medicare Advantage plans, folks in Hilton Head Island, for my Pennsylvania and my other states, I'm in South Carolina, but I there's about 14 different states that I do business in. So anyway, my point is, the hospital system, Coastal Carolina, Hilton Head Hospital, thousands. I had probably 70, 80 of my Humana clients had Humana Advantage plans. Again, there's a network of doctors. You go outside the network. In many cases, you pay 100%. And just because you don't necessarily get outside of network benefits, the doctors have to agree to the terms and conditions. So anyway, I had 10 phone calls that day. It was on the morning show, some morning guy out of Savannah. The Tenet Health owns the hospital system. They said, the heck with you, Humana. We don't want to negotiate with you. We're not striking up a deal. We're not taking your Medicare Advantage insurance anymore. So you had people way out on the island, Sea Pines, that had to drive to a different state. They had to drive to Savannah, find new doctors. They couldn't go to the hospital. I mean, unless it was an emergency, they had to go to hospitals over like in Savannah. So just because your doctor's in network not today doesn't necessarily mean they're going to be in the network 6 months from now. All right. So just be aware of that. And the other thing is, it's managed care. So sometimes you may want, your doctor might, say, hey, you need this type of surgery. And that's at the discretion of the insurance company. So you just got to be aware of that. And what my clients tell me is with the restrictive network, government pays the insurance company a fixed cost. They're managing your care as least expensive as possible. They're a corporation, they're an insurance company, they're trying to make money, all right? So just be aware of that. So, and Bill, the guy, his wife called me, the guy that's got liver cancer. He was one of those health nuts. He joked with me, I remember, it was like it was yesterday. He's like, I'm just going to get the zero premium plan. I go to the doctors once a year. And he didn't even want the drug plan. It came with it, but he didn't want it. So, we just don't know. We don't have a crystal ball. And, so he said, I'll take the zero premium because that's what I'm going to do till the day I die. Problem with that is between 65 and 75 are when you can get some some ailments, some expensive ailments. 75, there's a study done in Canada. At age 75 is when shit hits the fan for a lot of older people. That's when something serious happens, something expensive. So you know what? You just got to ask yourself, when you're entering your golden years, do you want to have maximum protection, maximum options, flexibility, choices at a fixed cost? You know what it's going to be every month. It's never going to be more than that, other than your premium. Or, you know what? Are you going to go with a zero premium plan and allow an insurance company to manage the heck out of your care? And when you need to get services done, they may not always be covered. And I'm just being straight with you. All right? It's funny though, insurance agents get paid a lot more on Advantage plans, a lot more. But to me, if you can afford it, if you can budget it, the time to get a Medicare supplement is during open enrollment. All right. So Medicare supplement means you have, so we looked at do nothing, like my buddy Anthony, but we caught him in time. That would have been a financial catastrophe, and he's got a lot of money, so that would have been a hard hit for him. But we got him a supplement in time. We talked about the Advantage plan, the good, the bad, the ugly. Now, Medicare supplements, this is what I suggest. If you're in open enrollment, you really want to take a look at, let me help you. All right, Medicare supplement means you have original Medicare. You got the freedom and flexibility to go anywhere that accepts Medicare, and most of them do. So everybody takes original Medicare. So the Medicare supplement just sits on top of the original red, white, and blue Medicare, pays the other 20%, pays your Part A deductible, pays all your outpatient surgery, pays your MRI, pays your CT scan. Thousands of people, well, I don't want to say thousands, but hundreds of people, my clients, like the freedom, they like the flexibility of a stable monthly premium that you can budget. And, all I got to say, guys, is if you can afford a Medicare supplement, for God's sakes, I mean, come on, you'd say you pay $130 a month, you get a standalone drug plan, you got to get a separate drug plan for whatever, $30. You just never worry about a big bill, you got a $185 deductible. That's it, big deal. When you turn 65 and you're brand new to Medicare and you enroll in Part B, that is your open enrollment trigger. On page 6, to get a Medicare supplement plan is when you're in open enrollment. That's 6 months after you turn 65. So the day you turn 65, that is your open enrollment starting period. Then you got 6 months out that you can still get on a Medicare supplement plan. Now, what we know is, because we write the applications, when someone is turning 65, 6 months prior to turning 65, they can start looking for a Medicare supplement. We can lock in the best rate 6 months previous to open enrollment. So you can look at, if you're in Ohio and you look at Mutual of Omaha, Cigna, Aetna, 6 months previous to your 65th birthday, we have the ability to lock in today's price, 6 months before you turn 65, and you're locked into that low rate. 6 months prior to turning 65, we can look at the market. We can lock in the best rate for you. So if you're in Ohio and you see that GPM Life or Mutual of Omaha or Cigna or Aetna, that has the lowest rate, that's the best rate today, but you don't turn 65 until 6 months from now, we have the ability to lock in today's price, even though you don't start paying your premium until your effective date, which is 6 months from now. How do we do that? I don't know why the insurance companies do it, but they let us. They let us lock in today's lowest rates 6 months before you turn 65. So the best case scenario is you're shopping before you turn 65. You can identify, with the help of an independent broker like myself, the best policy, the best rate, the best deal, and lock that thing in so you don't have to worry about it anymore. And that's what we do. We review the companies, we review the plans to make sure what's the best fit for you. We can lock that rate in 6 months before you actually turn 65. Then when you turn 65, regular monthly premiums start happening. Little known fact, many of the insurance companies I do business with will lock in your premium for the entire first year coverage. So follow me here. 6 months before you turn 65, you can lock in today's rate. But today's rate is locked in for 1 whole year from when your policy starts. So we literally have people that turn 65 6 months from now, lock in today's rate, and they get that rate locked in for 18 months before the insurance company can even look at a rate increase. So guys, it comes from the benefit of knowing which companies are best in your market. I worked with Humana as a career employee for many years, worked for another company as a captive agent. I understand insurance companies work from the inside out. What you need to do, I finally went independent because I knew one size does not fit all my clients' needs. So what you need to do is find an independent agent licensed with a multitude of carriers in your state. So if you're looking for a Medicare supplement policy or you have one and you've had it far too long and the rates are out of control, give us a call so we can shop that out. Now, after your open enrollment period, you will have to go through health underwriting, like my buddy Bill, the gentleman who just found out he has stage 4 cancer. All right, he can't just jump back on to original Medicare and get a supplement. There are going to be some health questions. They're going to ask you if you've been hospitalized in the last year. They're going to ask you if you have cancer, kidney disease, diabetes with complications. So you just got to be aware, and this is what I hate about the industry. A lot of times agents don't tell you when they put you in an Advantage plan that if you get sick, you're stuck there. You do not have the freedom and the flexibility to go to the Mayo Clinic or MD Anderson or some other specialty place. And your Medicare Advantage plan, usually they're an HMO or a PPO. If you want to go to a specialty place like a Mayo Clinic, you're going to pay 100%. It's out of their network. All right? So you can't just hop back onto Medicare and get the supplement without the health questions. So again, COPD, diabetes, heart attack, kidney disease, those are the types of things. They're going to ask you if you had surgery or do you have surgery coming up this year. If you answer yes to any of these questions, you cannot get a Medicare supplement. So the point of this video is read this document, read page 16 of choosing a medigap buyer's guide to choosing a medigap policy. And you'll see the best time to choose the best coverage is when you turn 65. And why not? You've waited your whole life. Costs are so much lower than when you had employee or group coverage or an individual coverage. So you deserve the best plan out there. Freedom, flexibility, and the treatment choices that are available to you and your doctor based on the quality of care and not saving the most money. All right, so just give us a call at 843-227-6725. And if you're in the open enrollment period, give us a call. I guarantee we got the best plan for you. And you pay us nothing for our services. It's like you don't need to do this alone. We'll be your health advocate throughout the year. We'll help you find the right plan. If it goes up a little bit, we can always shop it out. Help you with your prescription drug plan. And whether you go direct through the carrier or you use an independent agent like myself, licensed with all the different companies, your monthly premium is going to be the same, so why do it alone? Just like car insurance or home insurance. So why not have a licensed agent like myself help you out? Give us a call at 843-227-6725 and have a great day.